Hello, I'm Cassandra Lopez, and I'm a gynecologist at Women's Centro de Salud, a women's center of health in El Paso, Texas. I serve women with low socioeconomic status to those who have no access to prenatal services. In the past year, I have seen about 300 cases of chlamydia out of 1,100 patients. At first, chlamydia was not suspected. Women were coming in having difficulty getting pregnant or complaining of excess vaginal discharge. Most cases, however, were asymptomatic, and a series of transvaginal sonograms and sulpenograms had to be ordered to further see what was going on within these women's bodies. After sulpenograms and transvaginal sonograms were done, it was found that 20% of the women had ectopic pregnancies, and almost all were affected with chlamydia. This explained the high rate of infertility within the town. The course of treatment with different doses of azithromycin and doxycycline were prescribed to the patients. Abstinence is another course of treatment for the patient to prevent reinfection for themselves or infection of others. Depending on how long the woman has had symptoms of infertility or of excess discharge, determines the course of treatment. If the symptoms have been over a long period of time, there is indication that the patient has had long exposure to the bacteria chlamydia and needs immediate heavy treatment. I have a patient within my facility that I will refer to as 9. She is 20 years old, Hispanic American, from a low socioeconomic family. She has had previous medical issues such as sores around the genitalia and excess vaginal discharge. Symptoms of other STDs such as gonorrhea and genital herpes. Though the patient has other STDs, chlamydia was among the last to be diagnosed, considering the lack of symptoms. The number one treatment I have diagnosed the patient 9 is a series of antibiotics to conquer the bacterial disease. Early treatment and abstinence will prevent the young girl from further complications of fertility when it comes to getting pregnant. What I would recommend is a preventative incentive towards chlamydia or other STDs amongst this community. It is to enhance sex education within high schools and colleges. Within a high school community, health education emphasizes on the effects of STDs later in life, rather than taking the scare you out of sex approach. Having speakers in lecture classes or conferences that have experience with the disease will make it more real for the students and grab their attention. As health professionals, we need to educate our patients as well and not just treat the patient and grant them with a prescription. That is not going to solve the problem, and that will just convey that all they need to do is drink medicine and they will be fine. We need to educate with a purpose, and with that purpose is for them to change old habits and create new ones. The major problems that we still need to be solved is how to educate young adults that are not in school or longer in school. There has to be a way to convey health, sex education to adults that are no longer in a school setting.